Да, я запустил. Сейчас. Жду еще 2 минуты. Но это без видео, да?
Ну, без веб-камеры.
Да.
Все верно.
Это здесь?
Добрый день. Good day. Our topic, multiple and associative injuries. Definitions polytrauma included 3 definitions. It's multiple trauma, associated trauma, and combined trauma. The organizations of help in polytrauma. The countries of the Community of Independent States is Hospital of Emergency Aid. United States of America, England Traumatological Centers, German, Switzerland, England Clinical Infant Chirurgy, on Poland Clinical of Surgical Injury, on Russian, Ukrainian, and other country, it's Hospital Emergency Surgery. Multiple trauma. Definitions. It 2 and more injuries within one cavity or a system. For example, you look, it's woman after automobile accidents. 1 mechanical trauma. And you look, fracture both thigh, fracture leg, and other on one moment. It's 2 and more injuries. It's multiple trauma. Next, associated trauma. Simultaneous injuries of 2 cavities or injuries of internal organs and the segment of locomotor systems. For example, you look, it's patients after automobile accidents have damaged pelvic instability and close trauma with ruptured internal organs. First moments. Prepare for operative treatment on abdominal cavity, made stability of pelvic. Associated trauma. More severe conditions of patients with dominant craniocerebral injury, presenting about 40% of all cases. Lethality composed 20-30% in this case. Combined trauma. Injury due to the effect of different damaging factors. How many damage factors? It's mechanical, thermal, radiative, chemical, and others. For example, you look, it's patients who have injury after explosive. And what trauma? First, mechanical factors. Open fracture left leg, rupture right leg, and thermal factors, burns both leg and peroneus ligule. You look, what arrest or bleeding? Would tourniquet, apply of tourniquet, and apply forceps. Traumatic disease. Pathological process caused by severe trauma and manifested by characteristic syndromes and complications. Traumatic shock have many definitions. On our chair, very like its definitions. Syndrome of hypercirculations with disturbance of tissue perfusions develop in response to mechanical injury and other pathological effects, and their complications with results in decompensations of vitally important functions. Key moments of shock is hyperperfusions and hypoxia, which define the following metabolic disorders: coagulations, blood systems, and immunological status. Nitrogen oxide formed as a result of activations of cytokinins in endothelium corpuscles, pathological widening of the vessels. Decentralizations of circulations of that contribute to irreversible of shock. The main pathological mechanism of traumatic shock. Not have shock. No. Afference or a painful nociceptive impulsations is only one key moment start of traumatic shock. Next key moments is hypovolemia due to acute blood loss. Next is endogenical toxemia. It's not poison. Look how many endogenical toxemia have road. Have four road. First road start endogenical toxemia. It's absorptions. Toxin on necrosed tissue pass to body. Next chemical. It's decrease oxygen and chemical process made without oxygen. Its road produce many toxic chemical process. Road number 3. It's infections. Start pathological microorganism produce many toxin. And road number 4 for start endogenical toxemia. It's not normal presence functions, kidney levels, its retentions, road endogenical toxemia. Next key moments of shock is polyorganic insufficiency. Injuries. One locations intensify the severity of the other one. General severity of the cause of traumatic disease due to the number of traumas increase not in arithmetical progressions, but in geometrical one. Severity of polytrauma has 3 degrees. First we look yellow, green, and dangerous to life. Traumas do not present the danger to patient's life. Next step, you look, it's yellow, dangerous to life. Traumas are injuries of vitally important organ and system. This may be eliminated. And you look red, it's fatal traumas, means disruptions of vitally important organ and systems. This cannot be restored. On this case, patients die on first hours or a day after trauma. Realizations of traumas. On accident place, not right full diagnosis. You must say it damage head, neck, abdominal, pelvic, spine, or extremity. The period of development of traumatic disease, according to classifications by Roginski. Acute period, traumatic shock, post-hemorrhagical anemia, the syndrome of mutual aggravations, 1 week. Next, the period of early acute bioinflammatory and necrotic complications, 2-3 weeks. Final period of traumatic results, late bioinflammatory and dystrophic complications. Without order and correct administrations, there is not the use from a great number of doctors. It said very famous Russian doctor Nikolai Ivanovich Pirogov. The salary in road transport accidents in the country composed 17% case. The main reason of death in traumas is acute blood loss and traumatic shock. The salary in traumatic shock composes 40% case. In 20% of cases, death occurs at place of accidents. In case of critical hypertension, not more than 1 hour's duration. Lethality composes 19%. If 3 hours, 35 hour, 3 hours, 88%. Traumatic shock more often develops in real form. Standard of doctor's activity. To fix the time of accidents and time of ambulance arrival to the place of accidents. To eliminate panic and organize self and mutual help among people. To establish and support the contact with ambulance stations controller. To determine the number of victims and the main character of traumas. To start classifying and rendering to the first aid in cases of dangerous to life conditions. To determine the order of work of ambulance brigade and arrived to accident place. To organize interactions with the Rescue Ministry of Internal Affairs, Road Transport Self, Fire Brigade and military forces. To fill in medical documents. Algorithm of examinations of injured personnel at accident place. Revisions of oral cavity and the upper respiratory tract. Evaluations of the rate and character of breathing. Determinations of indications for artificial lung ventilations. Evaluations of hemodynamics, pulse, arterial pressure, shock index. Evaluations of neurological status. Examinations of external injuries, colorimetry of traumas. First algorithm, evaluations of respiratory systems. Clinical signs of acute respiratory insufficiency and indications for artificial lung ventilations, it's tachypnea, more than 35 respiratory movement per minute, excitement or a coma, cyanosis, or a cell contractions, the participations of auxiliary musculature in breathing, on the background of marked dyspnea and hypoventilations, tachycardia or bradycardia, pupils dilatations. Evaluations of hemodynamics. In the presence of great number of injured persons, one can approximately determine to the levels of arterial pressure by means of pulse. If pulse is felt on the radial artery, arterial pressure is higher than 80 mm per mercury. If pulse is felt only on the carotid arteries, arterial pressure is higher than 60 mm per mercury. The volume of blood loss on the way to hospital may be determined according to the shock index by Algorithm. Shock index by Algorithm is the relations of pulse rate to the value of systolic arterial pressure. Repeat, shock index by Algorithm is the relations of pulse rate to the value of systolic arterial pressure. In normal, it is half unit. It's a sequent increasing at 0.1 corresponds to the loss of blood volume to 200 milliliters, or a 4% of circulation blood volume. Mistake to the side of decreasing blood loss composes 15%, but it is shown not used in case of slow bleeding. Look, stable would determine degree of shock, method by ALGORIPHM. If shock index 0.8 is first degree, shock index 0.9 to 1.2 is secondary degree, 1.3 unit to 1.4 is third degree, if more, 1.5 is terminal phase of shock. Algorithm of examinations of injured persons at accident place. Table method of evaluations of blood loss. Severe chest trauma, traumatic abruptions of leg, it's 1500 milliliters. Fracture of pelvic bones, 500 to 1300 milliliters. And other. If patient have fracture of femur, if blood loss 1 liters. Fracture of arm, half liters. Fracture of leg, half liters. It's table method, very effective on accident place or early time admitted patients on admitted departments. Algorithm for examinations. Threshold of death is not defined according to blood loss volume, but it is defined according to the number of circulating erythrocytes. Critical reserve presence, 30% of globular volume, for plasma 70%. The organism may survive after loss of 2 or 3 part erythrocyte volume, but death may be occur in case of loss of 1 or 3 part of plasma volume. Normal volume of circulation blood in male is 66 ml per kilograms, in female 60.5 ml per kilograms. But it's a theoretic method. Why? You know, determine weight patients before trauma. It's maybe only theoretical questions. Evaluations of neurological status. Evaluations of sense organs may be carried by means of Glasgow-Combe scale 1977. Yes. Included opening of the eyes 3 4 balls, to speech 3 balls, to pain 2, absent 1. Verbal reactions orientated 5 balls, scrambled speech 4 balls, inadequate speech 3 balls, inarticulate sounds 2 balls, answer is absent 1. Motor reactions. Normal free movement 6, reactions to pain 5, normal flexions 4, abnormal flexions 3, extensions to pain 2, reactions absent 1. Summarized marked 15 points clear consciousness, 13-14 points stupor, 9-12 points sopor, 4-8 points coma. Examinations to external injury and quantitative evaluations of severity of local traumas, colorimetry of traumas. Prognosis of survival is determined according to different formula. It's nomograms, trauma score, mortality predictions model, and other. Maybe have separate for 2 types. It's method. First, it's help for practice doctors for make normal program of treatment, and secondary for control for its doctors. It's maybe head department, prokurors, and other for patients must live or must die. To provide mobility to respiratory ways, to evaluate degree of respiratory insufficiency, to determine indications for cardiopulmonary resuscitation. To evaluate hemodynamics. A patient of horizontally with left lower extremity in case of bleeding. Its synonyms dry hemotransfusions. If you lift lower extremity, maybe 1 liter of blood pass to live important organs. It's lung, cardio, and liver. If you lift upper extremity, maybe pass to centralizations of blood 0.7 of liters. It's very important moments on accident place. If you wait ambulance brigade or not other method, you made it dry method of hemotransfusions. Standard of rendering doctor's assistance in polytrauma at pre-hospital stage to provide temporary stop of bleeding. French surgery said, loss more when you made hemotransfusions. First, it's may arrest of bleeding. Put eteral tourniquet or a tense bandage for arrest venous bleeding. Putting of compressed bandage for venous bleeding, tourniquet of clamps on vessels in eteral bleeding. You look on its picture slide, show you anti-shock costume kashtan. It's a Russian costume. Have analog to other country, United States, France, German, Israel, and others. But principle same. Patients lie on hard surface. If patient have trauma of vertebrae, it's very important. Have specials splint, but it's neural splint. Made pump, and if you made an immobilizations, and you arrest internal bleeding on hematoma. And you look, if your patient have fracture of thigh, if you apply its neural splint, patient have blood loss not 1 liters, maybe very decrease its bleeding. It's very important how what have pressure patients systolic and how time after trauma. But very important moment, it's not neural splint. Very important, it's splint. It's maybe a painter made mistake. You have separate. You have two splint, one to abdominal, secondary on pelvic. If patient have trauma on pelvic and abdominal organs. But if you patient have rupture and spleen and HEPA, you patient have 15-20 minutes. If you apply its neural splint and pressure what systolic pressure patients, you arrest bleeding. And your patient have maybe 2 hours after trauma. It's correct time for applied patients admitted to operative room and made operative treatment. The patient have chance. Repute occlusive dressing in open pneumothorax to make pleural puncture if patient have tense pneumothorax. To provide approach to the vein, generalize peripheral vein if there is a special skill with a firm fixations to perform infusion therapy. Look, first anti-shock measures, it's arrest of bleeding. Secondary, it's infusion therapy. Step number 3 anti-shock measures, it's anesthesia. To give anesthesia to means of introductions of narcotic, anarcotic, analgetics, inhalated anesthetics. Very important moments. Comatose conditions does not prevent passing of painful impulses. That's why anesthesia is obligatory. Introduce narcotics or non-narcotics. If you patients have close trauma of abdominal, contraindications, introduce narcotic. If you know only isolated trauma of palm, 70% neuroreceptions presence on palm, very severe level of pulse, correct, prescribe narcotics. Or if you presence very far distance on hospital, very bad road, transport may more than 1 hours, you introduce narcotics. Why it's very important? If you introduce narcotics and admitted patients very short time on admitted department, don't know it's trauma of brain or it's narcotics. If you introduce narcotics, the fun symptoms of abdominal cavity remove. And maybe not determine on early period catastrophe on abdominal cavity. But if it's trauma down, you have non-narcotics, analgesics, have inhalated anesthesia, please not use narcotic. Aseptic dressing on wounds. And last anti-shock measures, number 4, is transport immobilizations. What indications for transport immobilizations? 4 indications. First, fracture. You determine fracture pathogenic symptoms, or I think maybe you must apply transport immobilizations. Next indication for transport immobilizations, damage of joints, including dislocations. Indication number 3, damage magistral vessels and nerves. Indications number 4, damage soft tissue, including wounds, crash syndrome, burns, frost bites. And next, it's symptomatic therapy. Transport of injured persons to medical institutions, rendering symptomatic therapy on the way to hospital. The drawing made by Professor Bliskunov are used in these lectures. These lectures are our lectures. You have questions? How many students? Correct. If you don't have questions, thank you. Lectures finished.